Health outcomes. Changes due to interventions. To bring positive change, patient experiences and health must both improve. Healthcare costs must be lowered, and clinician and staff burnout has to end. But our problems are big. 133 million Americans have at least one chronic disease. 500,000 people are dying every year from hospital errors, injuries, and infection. The shortage of primary care professionals will be as much as 100,000 in just the next 5 years. Big problems require bigger solutions. Positive change needs acceleration. It needs to happen now. But these are not so easy solutions that many don't want to hear, and even fewer are willing to talk about. How to lead such a change? How to discover, discuss, and disrupt healthcare to make a difference now? This is VITALS, Visionary Health Leadership in Action.
Welcome to VITALS, Visionary Health Leadership in Action. My name is John Langell. I've had the privilege of being part of the Northeast Ohio community for 1 year today. It's an absolute privilege to be able to serve as the president of the Northeast Ohio Medical University. We're in a region with some of the most respected and outstanding health systems in the entire world. And healthcare is being delivered at an amazing level in the United States. Amazing advances take place every day, and yet we've got significant issues with access, with quality, with affordability, and certainty with equity, and how care is being distributed to everybody within our population. We need change, and clinicians need to be part of that solution. Increased costs have plagued the healthcare system. Physician and clinician shortages, the two combined, have resulted in longer work hours, decreased time to be able to spend with our patients. And this, in effect, has contributed to physician burnout, to increased clinician suicide rates, and certainly to patient dissatisfaction. We need to step up and implement change, and we need to do it in a way that's absolutely meaningful. We can't leave this to only administrators and to legislators. It's absolutely critical that clinicians advocate for our patients, for our community, and for our colleagues. To do that, we need to be engaged, and we need to be informed. That's why VITALS was created, to help begin that conversation so that we can stimulate thoughtful discourse, to engage our community of colleagues, to lead that change hand in hand with our legislators and our administrators. VITALS, value-based, innovation, technology, advocacy, leadership, and service are the key tools that we can use to implement that change. This forum was created on a unique principle that we bring in a subject matter expert and give them 17 minutes to address a topic and stimulate that conversation to engage us. Why 17 minutes? Because that has been reported to be the average amount of time that a primary care physician is given to interact with a patient. And while you'll notice that this is enough to get us going, it's certainly not enough to complete that conversation, which should lead you to question, is 17 minutes enough to really adequately care for our patients? We're also very fortunate to have Monica Robbins from WKYC TV here to moderate the question and answer session. Monica is the senior health correspondent, and we're absolutely honored to have her here with us today. I also need to thank the NeoMed Foundation for underwriting the VITALS program and allowing us at no cost to deliver this to you, including the ability for you to take away continuing education credits. And I am honored today to be able to kick off the very first VITALS program with Mr. Bill Considine. I can think of no better expert to lead us in our first discussion. And while Bill really needs no introduction, he is an absolute leader in healthcare delivery and a diehard advocate for our patients. Many of you know Bill. He has been the CEO of Akron Children's Hospital for 40 years, and during that time built it into one of the most outstanding children's hospitals in the entire world. We're honored to have him here today. Please join me in welcoming Bill to the stage.
Well, thank you, John. It really is a real privilege to be here at NeoMed and to share some thoughts with everybody in the listening audience. First and foremost, I want to acknowledge the leadership that John has brought to me over the last 1 year. I know personally I really admire his focus on a bright future for this wonderful organization. His focus on collaborative and a collaborative spirit that he's advancing with all the partners. His focus on the patient and the educational experience that our students get that matriculate through this program. I also want to acknowledge what VITALS means to the work that we all do. The fact that he had the insight to launch this program says volumes about his values. And I know that all leaders will benefit from doing vital signs on their leadership based on what they're going to learn from this program over the next several sessions. So the honest conversation we need to have about leadership is in front of us. Let's take advantage of that. Let's share the good and the bad relative to what's playing out in healthcare leadership in this industry. Let's share the good and bad relative to leadership right now in this country and make a difference in the time we put into the work that we do. When we talk about VITALS, you've already heard, it's all about value-based. It's all about being someone that understands innovation and how to use it. It's all about technology tools and how you use those. It's all about being an advocate, using the right kind of voice. It's all about leadership too, and how you define leadership and what your leadership style is. And of course, it's about service, service above self. I know in my 50 years in healthcare and 40 years, as you've heard, being CEO of Akron Children's Hospital, I had experiences in each of those areas. I've had life lessons in each of those areas. And let's talk about a little bit of that right now. Value-based. That's the first letter in VITALS, the V. And I know from my perspective, I had the fortune back in 1979 of joining a value-based organization, Akron Children's Hospital. And it started back in 1890 when a group of women came together to open a nursery for children. Behind the reception desk in that nursery, they put 3 promises. Promise number 1 was, we promise to treat every child that comes through these doors as if that child's our own. Promise number 2 is, we promise to treat you the way you wanted to be treated. Customer service well before it's time. And promise number 3 is, we promise never to turn a child away for any reason. Back in 1890, they charged a nickel a half a day, a dime a full day, and that was not a challenge. What the challenge was, they wanted to be open to children of all colors, because there was race tension in Akron, Ohio. With that value-based organization and foundation they established, we've grown to who we are today. And I'm proud to say that every meeting I participated in over a 40-year period of time, every board meeting, we started with talking about those promises. That's being value-based. And as a CEO, as a leader, how do you promote those type of values? You promote it through a culture that you very much nurture through all your actions and all your words. And it's got to be a culture of respect. It's got to be a culture of trust, responsibility, caring, fairness, and citizenship, both in the hospital as well as in the community and in your home. You do that, and you have that kind of culture, and you can deal with any challenge that comes your way. So I learned from that. You can learn from that. And understand, too, the key to culture is mission. And the bottom line of our organizations in healthcare is mission, not margin. When you get focused on mission, you win. When you get focused on margin, you're going to marginalize the work you can do as an organization around focus on the patient. Let's talk a little bit about innovation. A friend of mine who's a historian has pointed out to me many, many times that we need to take the time to understand and research the past. We can learn from the past. We need to respect the past. Having said that, he points out, but we don't need to live in the past. We can build on the foundations like what was built by the women back in 1890. We can build on that when we respect it. And he's pointed out many, many times that status quo is our worst enemy. And that's why innovation can be brought to the table to make a difference. I've seen all sorts of innovation that has benefited the work that we did at Akron Children's. On a recent building program, we had an estimated cost of a new facility of $250 million. In the old days, I would have signed a guaranteed maximum price not to expend $240 million. Someone came forward, though it had been empowered, and said, you know, Bill, we could probably do that for a lot less if we used something called integrated project delivery. We embraced that concept. And through that, a target price was set at $180 million. The team worked together. They brought the project in at $172 million without cutting anything out of the original. That's innovation. And those are the kind of things that build on a culture of respect and responsibility and trustworthiness, caring, citizenship, and fairness. Let's talk a little bit about technology. And we're at a time right now where technology is just in all our lives. I shared just a little bit ago that I have Zoom fatigue, quite honestly. And I was on a call the other day where someone actually broke down and shared with us how they missed the human interaction. It was very emotional for this individual. And we were able to reach out and try to get them some help because they were in a bad state. Now, technology is important. There's good parts, bad parts. And let's, through leadership, figure out how we can harness the good. I know one way we harnessed it around quality and safety is the Children's Hospitals of Ohio came together many years ago and formed something called Solutions for Patient Safety. We know harm was being done to children in our hospitals, not intentionally, but through process that would break down. And through technology and through sharing with one another when something happened that was untoward, we learned about best practices. And then we started copying something. If we could learn something from Cincinnati or Columbus or Dayton, when we installed that. This solution for patient safety today now has over 200 hospitals here in the country and Europe working together. We could not be doing that without what happens when you have technology. You can share data quickly and learn from it. Those are the good components of technology. After we get through this pandemic, let's though spend time and reconnecting with the human element. That is so, so important. Let's talk now about the A of VITALS, and that is all about advocacy. And I have to tell you that in the last several years, most of my time has been spent on being a voice in advocacy, being a voice for children, and recently, being a voice for our public health officials. They're being attacked for them doing their job and dealing with this pandemic. It's unconscionable that we've allowed that to happen. When you look at the challenges they have, when you look at how much money as a country we spend on healthcare, it's like $3.6 trillion. And only 3% of that money goes to public health and prevention. We're already dealing a bad hand to our people that are in the public health field to keep us healthy. And we know that public health, if it's done right, leads to a strong economy. And one of the things that's played out right now in the pandemic is the economy's gone down because our public health investment's not been what it should be. We got to speak up about that. Use our vote to start changing those types of challenges before us. And also with children, when I look at how children are a forgotten population, they're talked about during the political process when the people need a vote, but afterwards the public policy that's done oftentimes ignores them. Children in our country are the most underinsured group we have. We have half of our 74 million children in this country are on Medicaid, and right now Medicaid and Affordable Care Act are under attack. And if any cuts go there, that's going to fall right into the laps of the children in our country who are our future. So speak up on the whole issue of advocacy if you're a leader. When we talk about leadership, then we get into how do you define it? Many years ago, I was asked to define leadership, and I said, you know it when you see it. And the people said, okay, that's fine, Bill, but we need more substance to that. So I did share with them something I've used on my own behalf over the years. I've taken the word leadership and I applied 2 words to every letter that reminds me of what my behavior should be, what my action should be. For example, The letter L is listen and learn. My mother always told me that. When I look at the first E in there, it's about empowering people, about exciting people with possibilities for the future. The letter A is all about being action-oriented and also advocating and having the right attitude. Attitude wins all the time. When I go on beyond that, I look at the letter D. That's about being someone that can dream. Think about the possible, impossible, and make it possible. People like to hear those kind of things. They really do. That's a vision. That's another thing we could talk about when we look at the V in VITALS. And then when you look at the next E in that, it's about earning the whole component of leadership on a regular basis through your actions. And it's about empowering people. People that are empowered can do things you can never do on your own. The R is about being a role model. We're all role models, whether you want to admit it or not, so be a good one. Through your behavior, through your actions, through all your words. And then the other component of that is being respectful. I've mentioned that a couple of times, but respect is very key to everything we do. And then when you get into the last part of leadership, the S is about being service-oriented. We're going to talk about that in a minute. And also about being a storyteller. People love stories, especially when they have a human element to it. The H is about being humble. You know, share the light with others. Leaders do that. Don't take all the credit. You don't deserve all the credit. Other people make things happen. And the other component is have a little bit of humor. Don't be afraid to put some things out there to laugh about yourself. That breaks down a lot of barriers. Plus there's an endorphin that's generated when you do laugh, and it makes everybody feel better. The I of leadership that I think about all the time is being intellectually independent. Don't follow the crowd, especially when they're wrong. Be courage enough to speak up about that. And then the other I there is improvement. Always think about how we can do better in terms of what we do and how we do it. And then that last component of leadership is the P. And it's a privilege to be a leader. If you don't embrace it the right way, you're going to lose it in a split second. And the other component is leadership is all about people. And you need to help them be the best that they can be. And that brings us to service, the last letter in VITALS. And when you think about healthcare, healthcare is a service industry. We're there to deal with the problems that people bring into our organizations. We cannot make this about us. We need to make it about them. It's service above self. And within that, there is sacrifice that's required. And there are certain people that just don't have that in their DNA. And that doesn't make them a bad person, but it does point out that they probably aren't going to thrive in a healthcare setting. So if you don't have that service DNA, we need to work that out or teach you how to have that, because our organizations are service focused. And John Langell has already said how he's focused on the patient experience. And we all need to do that because our patient experience right now is being threatened through the long waits, to the whole issues of not having access, affordability. I mean, it is a challenge. And we can change that if we work together. As I wrap up and before I turn it over to Monica, I have to tell you that one of the songs I listen to when I work out comes from The Lion King and The Circle of Life. I know my grandkids love it. I've seen the movie many, many times. But there's a verse there that really has caused me to think a little bit about, again, service. And the verse goes something like this. From the days we arrive on this planet and blinking step into the sun, there's more to be seen than can ever be seen. There's more to do that can never be done. Some say eat or be eaten. Others say live and let live. But all are agreed that join the stampede. You should never take more than you give. That's especially true in healthcare. You should never take more than you give. Give your all to the organization you're part of. If you're a leader, you have to give all times many, many points because your people are depending on you. And you model the behavior. When you model the behavior, you enhance that culture and you make your organization the kind of organization that's really focused on its mission, which really is the core that brings us all together and the bond that brings us together to choose healthcare as our profession. Thank you for the opportunity to share some of those thoughts. And I get now to introduce Monica Robbins. Monica, I know, I've worked with her for years. She embraces a value-based person. She is. She understands innovation and improvement. She understands technology better than me. She also understands being an advocate. Her voice on the news is something that always has a powerful message tied to it. And she is service-oriented. She's a storyteller. She also is someone that, again, supports our people in this community and our community. She understands healthcare because she's been on the other side of the in the bed, not too long ago. So Monica, let me turn it to you. Thank you very much.
Bill, thank you. Thank you so much. And thanks everybody for joining us. There's about 75 of you in here. And if you see the Q&A, I please encourage you to submit your questions there, and I will get to as many as I possibly can. We already have one. This is a great one. Stephen wants to know, what advice do you have to a medical or pharmacy student who wants to be a leader in his or her healthcare delivery setting after graduation?
That's a great question. I always love having students reach out asking those types of questions, because it tells me that they have the right motivation and they're not satisfied with status quo. I would strongly encourage them to get tied into a mentor at one of the organizations that are tied here to the medical school. And through that mentor, they can be afforded some experiences to see how things play out in the real world. You know, you have wonderful classroom didactic sessions. If you can take what you hear in classroom and then experience that in a real life situation, that's going to open some ideas to you, and you're going to be able to bring to the table with fresh eyes some new ideas. So try to tie into a mentor, try to tie into an organization, and take that whole experience you're looking for to another level. And I know the partners with NeoMed are very willing to bring the pharmacy student, the medical student into that kind of experience. God bless them.
That's great information, Bill. And again, everyone who's watching, if you have questions for him, please put them in the Q&A section at the bottom of your screen, and we'll get to as many as we can. Bill, in 2017, you published your first book called Leadership, and I'm so glad you went over what leadership means to you. But from a culmination, who was that book for, and what advice can you take from it now to apply to VITALS?
Well, the book really was for anybody that would really take the time and read it. I didn't mention that one of the components of the book that, when it was shared with me, caused me to write it, is to put into each of the chapters not only you know, how important it is to listen and learn, but then I talked about a patient family or an individual that I had some kind of contact with during my 40 years, that I shared the story, because young children have taught me a lot about leadership. They've taught me how they deal with various things with positive attitude. They've taught me how they can hear some bad diagnosis, but have a dream of being able to beat it, and they can beat it. They've shared with me their own stories that are powerful, that are inspiring. They've talked to me about a number of things, and as I said earlier, they can figure out if you're real or phony through your words and actions. So if you read the book, every chapter, the chapter L, the chapter E, the chapter A, there's a children's story in every one of those chapters. And I really wrote the book in tribute to them. And if I hadn't thought through this and had someone suggest it, I probably wouldn't have written the book. I would have continued to give a talk on leadership. But because of, again, what those children have meant to me, how they've blessed my life, and how I've learned from them, I wrote it for them and in tribute to them.
And I agree with you. I think everything I've learned in my industry, I've learned from kids, by the way. So Elizabeth wants to know, let me go back up to the top here. Elizabeth wants to know, healthcare professionals are at a constant risk of burnout and worse. I think service and values are key to sustaining ourselves, but how do you avoid the burnout in your career?
Well, as John mentioned earlier, burnout is a real issue. And I know when I look at, again, the demands, the uncertainty that's out there, we need to help in terms of bringing some sense to all that. Now, one thing I know too is that if you're in a culture that is a culture that values you, that is respectful to you, that you trust, that the people that are at the head of the organization aren't going to deal you as a poker chip in something, then you're going to come to work, if you're a caregiver, and be able to focus on what you're supposed to do, and that's care of the patient. If you're worried about whether you're going to have a job the next day, if you're worried about, again, an organization that cares more about a bottom line than they do a mission, if you're put in a position where you need an additional colleague, but you're not going to get that approved from a budget standpoint, the wrong message is being sent to the caregivers. But if you have the culture that, again, puts mission over margin, you're going to have some assurance as an individual. And that assurance creates a safe environment. And if people feel that their environment is safe, they're going to even work harder. They're going to go into that area of sacrifice that has to be done, quite honestly, for those of us that are in healthcare today. Sacrifice is a must. Now, sacrifice can't go so far as to create health issues with individuals. And those health issues come up, I think, because of some of the uncertainty and ambiguity out there. There's plenty of ambiguity. When I give talks to various business classes, I do point out, if you have a problem with ambiguity, you probably shouldn't think about going into healthcare management or healthcare administration, because it's there. But within that ambiguity, believe me, there's enormous opportunity. And even at Akron Children's, during my years there, the team that worked together took an organization with a $35 million revenue base back in 1979 to where it's over $1 billion. But more importantly, we're seeing over 1 million children through our programs. And when you focus on the care being delivered to those 1 million children, and you celebrate that, and you celebrate the caregivers that are providing that care, that brings pride out of people. And oftentimes they want to do more, and that is the energy they need to deal with the problems of burnout. You know, there's positive energy and there's negative energy. And I can tell you, when I go into a meeting and deal with negative energy, I feel that that meeting went a month and it might have only gone an hour. And I'm exhausted after those meetings. But when I go into a meeting where there's a can-do attitude and there's positive energy and people are being respectful with one another, and it goes for a while, I need more of that. I need more of that. So I think, one, we do have to deal with staffing issues. We do have to deal with the message we deliver to our caregivers, but it's not about just less work. It's the right kind of effort and the right kind of work in my mind. I don't know if that answers the question, but it's some of my thoughts.
Faiz wants to know, in your outstanding leadership and career, what is the most important lesson learned, and what is your AHA moment of your career?
Well, I didn't get fired in year one. You know, they hired, I was 31, I think, when I was hired. I do tell people that actually I was a patient at Children's Hospital. I've never been discharged because I can't afford the bill. But, you know, there's many, many aha moments, quite honestly. Some of the families I've had the chance of meeting, being able to grow into a culture that I talked about already. That's a culture that started back in 1890 by a group of women, learning from that culture, understanding what real respect is, understanding the whole issue of responsibility and trustworthiness, talking about how you're caring in all you do and fair in all you do when you need to make tough decisions, but embracing those other values and not personalizing those kind of things. Working on communication to be a good citizen in everything we do. I mean, there's so many of those kinds of experiences that I've you know, learned from dealing with the patients we serve, being given an opportunity to speak to elected officials, various kind of Senate finance committees at both the federal and local, state level. You know, there's so many things that really come to mind. I am very proud of the fact during my 40 years at Children's, we continue to invest in that mission. And during that period of time, even in bad economy times, we never had a layoff at Children's. We grew our workforce from a little over 900 to where we have now probably approaching 8,000 people within the Children's family. And we needed that in order to see more and more children. And I really feel very, very good about the way our mission has reached more and more children, and that our culture has enriched the people that are part of the Children's family, and we've learned that culture from those families that we're so privileged to serve. Our growth into Mahoning Valley 12 years ago, I mean, that is a highlight, quite honestly, of my career. Todd Children's Hospital, a wonderful organization. Their parent company had some financial problems. They were liquidating. In a very, very 11th hour, 59th minute, we stepped in and picked up the program. Had a year to where we had to build out a campus, started with 1 employee, and now we have probably close to 1,000 in the Valley. And what is really wonderful is all the children that are being cared for. And those promises would play. We're turning no child away because of an inability to pay. And we're striving to treat every child if that child's our own. Those are the aha moments to me. And I love sharing those stories, and I want to see more of them play out.
Ramel has a really important question considering what happened on Tuesday. Given the evolving political landscape, how can we best position ourselves as future healthcare providers to engage the support of our communities and the public at large?
Well, Tuesday was embarrassing. I mean, it really was. You talk about leadership. You know, the leader of this country needs to embrace those characteristics of respect. He needs to embrace responsibility, trustworthiness. He has to be caring, he has to be fair. And if you look at vitals, he should take his vital signs relative to his value base, how he uses the whole issue of information as well as innovation and technology, and look at what his advocacy is. I mean, children are lost in the various conversations I'm hearing right now at our federal level. I mean, they're lost. When we start talking about taking the Affordable Care Act away, that's going to affect a lot of children. In fact, in 2018, we saw over 500,000 children fall off of insurance logs. And prior to that, we were doing a pretty good job of trying to get more and more of our children insured because of the Affordable Care Act and because of the expansion of the Children's Hospital Insurance Program called CHIP. But now with a lot of the play that's coming out of our government, these kids are losing insurance. We've lost, here in Ohio, kids have fallen off the insurance logs. And that's just not right. When you have 74 million children in this country, and they quote are our future, and half of those children are covered by Medicaid. And when you think about Medicaid, it's not branded as a children's program, but it's the #1 insurer for children in this country. We should put the name children on the program that insures children and put money into that program. We spend 17% of our budget on military in this country, which is fine. We don't spend close to 2% on child health care in this country. Let's put that up a little bit. Doesn't have to be 17%, but if kids are our future, then let's invest in them. And we know our economy will be fine. We know we're going to be able to deal with some of the other social determinants that are there. Too many of our children have food insecurity. Too many of our children are homeless. Too many of our children don't have insurance. Too many of our children are facing dental issues. Too many of our children are being abused and neglected and exploited. And we need to do something about that. And one thing you can do is speak up and talk to your elected officials. I'm on a regular kind of loop with our senators and with our representatives. And I try to be direct. I'm not mean-spirited. I'm there as a children's voice. Our kids don't vote, so we need to vote. I can tell you, if our kids voted, if they were a voting bloc at 74 million votes, we would see some different public policy in this country. And don't be afraid to bring that up. We are the number, look at our country. I'm proud of our country. I served our country. Let's try to make sure that our brand speaks to our values.
Matthew is asking, how does a leader effectively support a workforce and evolution of an organizational culture?
Well, you know, culture, you've heard me say that many, many times. And it's the kind of thing that when you have it, you have to embrace it. You have to nurture it, cultivate it, shine that jewel. When you lose it because of lack of trust in leadership, when you lose it because you forget about mission, you have a hard time recovering it. So how do you really deal with that? If you're the leader, you have to live it. Your actions have to speak louder than our words. You need to be the cheerleader. You need to tell stories. And I found that stories always work. You look at the book on leadership and the stories I tell in that book about young children and their families. I can tell you when I'm speaking to various groups and tell some of those stories, it captures people's imagination. And we also need to capture the gift that we get from children that are coming into our world each and every day, because they are a gift. There's a gift of innocence there. There's a gift of all kinds of possibilities and imagination and inspiration. We need to bottle that and talk more about that and let people know how important it is when they work in healthcare, that they have an opportunity to make a lifetime difference through the culture and through what they broadcast. There's a little story I talk about, a young girl, and I always refer to her as a sun catcher, and I can talk about that a little later if you want.
Joshua wants to know, what advice would you have to someone looking to learn how to be a better leader?
Well, one of the things that we're fortunate here, the VITALS program, you know, take your time and involve yourself in this program. I also really think it's important to do a self-assessment of who you are and be honest. You know, look in the mirror and go through, if you want to use the leadership tactic I do, and evaluate your own self on being a learner and a listener. Evaluate your own self relative to your attitude and how you come across. Evaluate yourself on your behavior. Evaluate yourself on what kind of individual are relative to your energy. Do you bring positive energy? Do you bring negative energy? Evaluate yourself on, do you collaborate? There's another book I wrote called Success, and I played on the C letter in success. And every one of the chapters in that book talks about someone that's been a role model to me relative to their character in one chapter, relative to their civility in another chapter, relative, are they a communicator? And I talk about that. You know, what kind of commitment do they have in terms of what they do and how they do it? Are they phony or are they real? I go through, are they a caring individual? I talk about corporate citizenship, going beyond the walls of the organization you're in and making a difference. There's 12 chapters of the letter C in there, and there's people I talk about in each of those chapters. And when you put all that together, to me, that can help you define success. And you need to have a package of all that and just study it, and then do your own self-evaluation. And then there are all sorts of ways for you to enhance where you are in those areas, through self-improvements, through various courses you can get online, so being involved in the VITALS program, and at work, where you are, be someone that brings ideas forward relative to various kinds of programs your employer might have. I know at Children several years ago, we started something where we have a leadership academy for our people, where we try to put in place with them some things that we know are important for leadership. One of being emotional intelligence. I know a lot of very smart people in leadership positions that have zero emotional intelligence. They don't know how to read a situation. They don't know how to read an audience. And they think about themselves first versus others. So I, again, applaud that question, but it starts with you doing that self-assessment.
Dwayne wants to know, how can we best align the efforts and concerns of community physicians with healthcare institutions and systems to ultimately act in the best interest of our patients?
You know, that's another great question. You look at our healthcare system that we have, and we've allowed it to get very siloed over the years. And within those silos, within the system, we don't collaborate with one another. And I know Dr. Langell has talked a lot about what we need to do to break those silos down and work as a team, because we are a team. And, you know, when I started at Children's back in, again, 1979, we didn't employ any doctors. Now we employ probably 700, not because we wanted to employ them, but because we knew the way reimbursement is handled, that a private doctor on their own, they wouldn't get a fair reimbursement rate through Medicaid. Yet half of this state's kids are on Medicaid. So in order to bring talent to the table, by them being employed, we can do some global charging that gets a fair price paid for what is done. And we work together as a team. We don't believe in indentured slavery. We want to empower the physician leaders within our organization to take us to new heights. And I can point to program after program that's built depth, that's gone to new heights because of that. And we don't have silos. We don't fight with our physicians. We have constructive debate, of course. We don't have fights with our nurses. We have constructive debates. We have allied health professionals, and we're one team. And when you can be one team, it makes a difference. A friend, a coach of mine I've met along the way, Coach Krzyzewski, and by the way, I root for UNC, not Duke, but I still know Mike. He always would tell you, there's no I in team, all right? Team is everybody coming together in one hand. And that is very, very true in healthcare. So our alignment at Children's Hospital, something I worked on, and I know before me, Roger Sherman and other people worked on, it's so important. You need to have alignment between your board of directors, your management, your physicians, your frontline caregivers, your physicians, your nurses. You need to have alignment then with your community. You also need to have alignment with your donors, and most importantly, alignment with your patient population. If you do that, then it's not a we, they game anymore. And part of that alignment, the men and women in private practice, we need to support within the laws that are out there. I think some of the laws that are out there about not-for-profits supporting some of the corporate entities of private practice, they need to be relooked at. They really do, because we're in this together, especially if we want to deal with the problems of access and affordability. And the whole issue of inequality and the like, it's a problem. And we have to be in one team to fix it, and we can do that.
Doug has a really important question. How do we remove the stigma of mental illness, addiction, and suicidality that still exists within healthcare professionals so they'll seek help and seek help readily?
Again, these are all real issues before us. And right now, with the challenges that have been presented because of the pandemic, you're seeing a real spike in mental health issues, the behavioral issues. And we need to really get a focus on that. You know, teenage suicide has gone up 47% in terms of where it was in year 2000. And there is still stigmas around this. I think within the hospital setting, I know we've brought our mental health work out of the back room and put it front and center. You don't have to apologize for this. You don't have to criticize or make someone that's dealing with a mental illness feel as they're inferior. And this can be done, and it is being done. There's some nice models of this playing out around the country. There is a demand for more manpower here. And again, a demand for us to do something with the fragmentation that's playing out within our various mental health organizations, both those that are community-based, those that might be in another setting, as well as those at a hospital. Many years ago, I got in a battle here in the state of Ohio when for-profit psychiatric hospitals wanted to come into Ohio to care for kids. And I joined an effort by the Mental Health Association to oppose that. Because when I looked at what they did, after a 28-day hospitalization where they took down all the insurance would pay, they put these young people on the street. And that is not the standard of care that we're all about. So we fought it. And then we also looked, and we were held accountable for this because it was pointed out that we as an organization weren't doing what we needed to do in terms of investing, putting the mission around this as a priority with our organization. And they were right. We were challenged several years ago about not investing enough in primary care. And we've built a primary care network that has now about 36 office locations, saw 500,000 visits last year. But it on its own is not going to pay for itself. But when you look at the whole industry and the enterprise you're putting together, you can move the dollars around to make sure, again, mission is advanced. And we need to make sure we're doing that relative to mental health and behavioral care. We need some help. That's where advocacy comes into play. I think it's been interesting. We're now getting some reimbursement within the healthcare system for telehealth, and telehealth is helping in the mental health world, but also that human contact is so important. And we need to get people on the front line to be there for those in need.
Scott says, as someone who has experienced the healthcare system from the perspective of a patient, I find it has become complex, hard to navigate, and disjointed. It is frustrating and feel that some providers are missing the personal touch the patient really needs to recover from an illness. How can this be fixed?
Well, I agree with that observation. You know, over the last few years, my dad passed away when he was 95. My mom died last year ago, September, at the ripe age of 95. And some of their experience in healthcare was one that was not to my standard. And my mom, towards the end, she only wanted to be hospitalized at Akron Children's. But that wasn't going to work. I think what we need to do on this is be honest again with ourselves. Let's talk about where the breakdowns are, you know, and let's not make our healthcare problem the problem to the patient that comes through our doors. As I already said, there's a lot of uncertainty relative to what's going on with payment for healthcare, with Medicare, with the Advantage plans, with it's a very confusing situation. My wife and I right now are in the process of getting on Medicare. I've been around this for a long time. My eyes glaze over when I get on Medicare.gov and start trying to look at the options that are there. It's not patient friendly. And we got enough smart people to try to really deal with this. The other thing I think our organizations do is have to put some of their dollars into having patient advocates within the organizations that can help folks really maneuver through the complexities of our system. I mean, I know a lot of caregivers that mean well. They really do, but they're frustrated because of this. And unfortunately, oftentimes our frustration plays out in terms of their interaction with their colleagues or the patient. And oftentimes the patient isn't the one meant to be affected, but they see the dysfunction. And no one wins when that happens. So let's admit there's an issue. Let's get some good minds together and then talk about how we can change it. And let's take advantage of the folks that are coming into our business, the graduates from our healthcare, medical schools, and other kind of organizations. Let's take advantage of their fresh eyes. And if they see some things that can be done different, then let's do it. That's innovation. Let's not forget the right kind of culture. If we have the best culture, let's build on it. If we don't have that culture, let's figure out a way to get it.
I'm looking forward to hearing your response to Paul's question. So much of what we see in social media, leaders and influencers, etc., seems to be more about having an opinion and having the loudest voice, often drowning out others. Do you still think it's possible to be a quiet leader, one who leads by example? And is that enough in the current environment of sound bites and social media? Is there a place for the introvert leader?
I do think there's a place, because I really do believe that actions speak louder than words at the end of the day. Now, having said that, we need to look at what's going on with social media. I was in a conversation just recently. I'm on a board of an organization that deals a lot with journalism and the media today. And we look at the whole issue of where do you find the truth? And you know that the algorithms that are written on a lot of these social programs and that you then put on your iPhone as your app, they're going to figure out what you want to hear. And that's all you're going to get. They're not going to give you any other opinion different than what you want to hear. So you're going to base what you think is truth on that when it's not true. And we've lost that whole focus on truth in this country right now. And it's something we need to address. We really do. Whether you're liberal, whether you're on the other side as a conservative, and that's all you want to hear is views from those sources. Most of this country are moderates. And we want to see both arguments. And I think a good leader, whether you're an extrovert or an introvert, they can have an influence on that. Because if they speak the truth, the way they do it, that's going to register. It might take a while, but it is going to register. But I can tell you that what's playing out with cable shows, what's playing out with these various blogs, people can say anything they want on a blog, and then someone reads it and they believe it. That's not the country that my mom and dad grew up in. That's not the values that they passed on to me. And as long as I'm still above ground, I want to speak up about this, and I'm speaking up about it. I think that's what leaders need to do. I think an introvert can be a good communicator too. So the thing to do is not fall trap to those that are mean-spirited. Not try to be a name caller because someone else is being a name caller. You know, I grew up in a neighborhood where we had bullies, and you got around the bullies not by being like them, but by being true to the values, your family, and their day will come. Their day will come. I don't think social media is helping that right now, but I'm a real believer that our people will prevail. I'm a real believer too that the human spirit is going to win out over technology.
This is our final question. Stephen wants to know, looking into your crystal ball optimistically, what does healthcare delivery look like in 5 or 10 years?
I do think that because of what we've gone through with the pandemic, and a recent article I wrote is about how important public health is to our economy, that we're going to have more voices speaking out for the appropriate investment. I also think that within healthcare, some of the bigger is better, all these mergers that are going on, we're going to see a shakeout of that, because I think healthcare is local. I really do. And people like to know who their doctor is. Sure, they want to benefit from what technology can bring to the table. But I do think we're going to have a more personalized approach, believe it or not, as we work through the issues we're in. And let me finish with this story about a sun catcher, all right? In the book, I talk about a young girl by the name of Angie. Angie was 13 when I met her. Should be 42 years old last month. Angie had a bad case of cancer, and her body was ravished by the chemo and the radiation and everything else. But when Angie came to the hospital, our spirit always went up because of who this little girl was. Early on, she figured out that she wasn't going to be going to any proms, she wasn't going to get married, she wasn't going to have any babies. She knew the card she had been dealt. And what she became focused on is her parents, her siblings, her caregivers, her friends. And we didn't know it, but she turned the table on us. She became the caregiver and took care of us. And one way she did that, she used our art therapy program to paint out sun catchers. And you all know what sun catchers look like. You put them in a window, sun hits it, radiant light comes into a room. That was Angie. She brought radiant light into every room that she came into. even though she had a bandana and lost her hair, her eyes were sunk, her body was just again ravaged, but her spirit was just a sun catcher. And when she died, her mom came and talked to me about how important it was for us to learn from her daughter. The Children's was a great place, but we could be better. And she suggested we have a parent advisory committee and a parent mentor program. We did all that because of her mom, Joyce, and Angie's spirit. We wanted to keep it alive. And then at a year anniversary of the parent advisory committee, her mom presented me with a gift. Before Angie died, there were 2 sun catchers she hadn't finished. Her mom, Joyce, keeps one of those sun catchers at home, and it reminds her that her job of being Angie's mother will never be done. The other sun catcher she gave to me. And I look at that sun catcher every day to remind me, as long as there's a child out there that can benefit from my voice, then my job will never be done. And the fact I'm talking about a little girl that taught me that lesson when she was 13 years old facing cancer tells me that we have the wherewithal to make sure our healthcare system in the future is going to be a very bright and successful one. We just have to make it happen. Thank you, Monica.
Well, Considine, thank you so much for your valuable insight, and thanks to everyone who joined us and watched tonight and submitted their questions. I'm going to hand it back over to President John Langell.
Thank you, Monica, for leading that expert discussion. And thank you, Bill, for that amazing opportunity to listen to your substantive wisdom. You had an opportunity tonight to hear from a man who has led healthcare change, healthcare reform at every level. Not somebody who was looking to climb the ladder. He spent 40 years growing one organization, worried about mission, as you noted, he said, not the margin, not where are the dollars, but how can we grow the mission to do what's right? And even now, after stepping away as CEO, he continues to make the circuit around the state and around the country, advocating for children's health. There's a lot to be learned here, more than we could share in 1 hour and more than he can share in 17 minutes. I just hope that through this discussion and this presentation that we've stimulated 2, 3, 4 or more of you to start to think differently, to realize there's more that you can do to build your skill set to be that advocate for our patients and for our community and for our colleagues through advocacy. It's not simple to say you can be an advocate. You have to really understand how you're an advocate politically. Policy reform has more impact than going out and getting an insurance company to take care of one more patient. You affect entire populations. You, as the future leaders and the current leaders, can do so much more for the healthcare system and for all of us in this country by practicing the skills that Bill talked to us about tonight. Thank you, Bill. It was remarkable.
Thank you.
We're going to continue VITALS over the course of the next many years to come. And our one goal is to stimulate discussion and to stimulate all of us to be leaders and to be part of that solution for healthcare change, healthcare reform in the system in which we live. And it's going to help all of us when we do that. It's really critical that we all participate. I'm very pleased to tell you that our next VITALS speaker is actually a neomed grad and a leader, is Dr. Rajiv Venkaya. Dr. Venkaya is the president of the Global Vaccine Business Unit for Takeda Pharmaceuticals. This will be a really relevant topic in today's current pandemic environment as we hear about global vaccine development. And for now, thank you all for participating. Go out, fight the good fight, be the leaders, and let's reform healthcare for the better. Thank you.